Thank you so much for coming, and thank you for having me. Just briefly, I'm a neuropsychologist, and I spend much of my time at Toronto Rehab, which is part of the University Health Network, and I work on an outpatient neuro rehab program. But I've also been involved with the Canadian Concussion Centre for the past few years in some research, some studies that are ongoing, and also providing some services. So we've been running workshops for the past 3 years out of the Toronto Western to individuals that are experiencing persistent post-concussive symptoms. So I think we'll go on to have each of the panelists introduce themselves. Maybe we'll start at that end with David.
Hi, my name is David Bourque. I had a motor vehicle accident in 2008, a single vehicle motorcycle. And I had been playing in the Toronto Symphony to that point in my career. It was my full-time career. I was there almost 30 years, and that motorcycle accident ended my career. And I'll tell you a little bit about the wild things that happened. I'm sure you've heard many different versions of concussions, but mine are very specific, yet they're all the same. The stories are all the same. So, David Bourque, nice to see you.
I am Colleen Worsley. I sit on the board for BISC, the Brain Injury Society of Toronto. I also work with individuals in the community or in clinics who have had an injury, a traumatic brain injury, and working with them, supporting them in recovery and building community connection and identifying their strengths and their needs post-injury.
Hi, I'm Carmela Tartaglia. I'm a clinician scientist. I see patients both with neurodegenerative disease and post-concussion syndrome at the Toronto Western Hospital.
My name is Sophia. I'm one of the lived experience panelists as well. I'm actually currently an intern with Healthy Minds Canada. I'm also a student at McGill, and I work with the Concussion Legacy Foundation, specifically the Montreal chapter, which is called Concussion Montreal, where I sit as on the executive and as the support group director. I am currently in continued but ever improving recovery from a concussion sustained in January 2016. I had a lot of physical and mental symptoms as well, which I'm sure we'll get into.
Great, thank you. So in terms of the format today, I think we're going to spend sort of the initial bit, I'm going to be posing some questions to the panel, and then towards the end, we'll open it up for questions from the audience. So the first question is directed to Dr. Tartaglia. What do we know about the link between concussions and mental health and the impact on mental health?
So I'm a clinician, but I spend a lot of time doing research. And in our research program and in our clinical care of people, we realize that all brain injuries can be associated with mental health issues, as well as the cognitive issues and motor problems. So when people have major traumatic brain injuries, we know that, as a consequence of that, you can end up with mental health, physical, problems with memory, problems with concentration, thinking. But mild brain injury, mild traumatic brain injury, which is what, another word for concussion, was kind of thought to be a really benign entity, and so there wasn't really this understanding that I think now is quite clear that it's a brain injury that happens, a brain injury that causes changes, because really your brain is actually who you are, and your brain determines your personality, your thinking, your movements, everything. And so even a minor brain injury can have significant effects. Most times, luckily, people recover. So 85–90% of people will have a minor brain injury called a mild traumatic brain injury, and they will have no long-term sequelae. But in some cases, people do end up with chronic problems that can last for months and even years. And these, there could be headaches, could be dizziness, it could be depression, it could be anxiety, it could be foggy thinking or poor concentration. And the mental health issues are just as important as other issues. But yes, they can all come about from just a mild traumatic brain injury.
And this next one is directed more towards David and Sophia. If you might each be able to speak about how the concussion has changed your life after the concussion. And sort of give us a bit of a picture, what things were like before versus after.
Well, playing in a major orchestra like the Toronto Symphony requires a high level of cognitive skills, as well as, practical experience and the like. And I had been in the Toronto Symphony 25 years before I hurt myself. And I was pretty much at the peak of my career. I remember going home one day and saying, boy, this is what it's like to be at the top of the game. And that's where I was in my early 50s. I felt like I had the best game I ever had in my career. And I had this motorcycle accident, and I'm not really sure exactly what happened. I walked away with my life, which was quite surprising, because I just missed boulders and a metal culvert, and I was traveling at 70 kilometers an hour. And I walked away with 5 fractured ribs, which was all consuming at the beginning, with the pain and this medication I was taking to try to manage the pain. And then I didn't even notice I had a problem for quite a while, except when I went back to work at the Toronto Symphony, I would look at notes on the page and I would not know what buttons to press. And I remember my first week back, we were rehearsing a big piece by Dmitri Shostakovich, a big symphony. And there was a large bass clarinet solo at the very end of the piece. And it wasn't really familiar repertoire to me. I might have played it once before, I'm not really sure. And when it started, this little solo started, it's at the very end of the piece, and it's long for a solo. It's almost a full page long, which is really long. Normally we get really excited about a bar or two, but it's a big long solo, and I have no idea to this day what came out. I have no clue what happened. We did it again, and I think it was better. And we were playing performances in Toronto, and we went to Carnegie Hall with it, and I just don't remember what came out, but apparently it was okay. So that's how my life changed. And I only played another couple of years after that, and I was unable to continue.
So for me, my accident happened again in January 2016, and it was the middle of the day, and I just fell on stairs. So quite the small, well, not small, I realized later, but it felt kind of insignificant, but it turned out to have a huge impact on my life and on my brain. I was trying to think of what I would say to answer this question, and it occurred to me a sentence that I wrote in a blog that I put on the group that I now work for's website. This was 3 months after the concussion, and I wrote, I'm a bit flair for the poetic here, but I wrote that recovering from a concussion for me felt like living in a body and thinking in a mind and feeling with a heart that was not mine anymore and that was very broken. And that kind of is, though a bit poetic or dramatic, is how it felt for me. It kind of changed everything because it changed me. That's what it felt like. Before my concussion, I was a possibly too busy student, worker, friend, social butterfly with relatively good mental and physical health. After my concussion, I was not able to be in school for a while. I was not able to work. I was having trouble reading, remembering why I'm walking across a room. I had trouble if more than one person spoke at once. I just couldn't understand. And then the biggest thing, I guess, is that my mind felt like it wasn't mine anymore. I had relatively good mental health. I'm very lucky up to this. Afterwards, I was very depressed. And as I found out later, I was suffering from PTSD as well, which blew my mind because I had no idea that that could happen from a concussion. So changed my life in a lot of ways. And I actually still, a year and a half later, have residual mental and physical symptoms. So a small bump, and much came afterwards.
Thanks, Sophia. And are you continuing to see improvements still? Like it's been?
Yes, definitely. So I took 8 months off from school. 4 of those were the summer. So, and I went back with 1 course. And then the next semester I took 2 courses. And next semester I hope to take 4. So that's, just the school aspect, but it is kind of a metaphor for everything. It's increasingly good. I had chronic pain and nausea and vertigo or bouts of vertigo for about a year straight. It was either constant or daily that I was experiencing that, and now it's daily but not constant and so manageable. So, and for the mental health aspect, it's again still a daily different experience, but I no longer really associate it with my concussion as much because I'm just so much better. Yeah, so a lot better.
That's good to hear. The next question is directed at Colleen. Colleen, for individuals who are struggling with their mental health after concussion, can you just talk about what resources and services are available?
Okay, so because there are so many layers to what that depression or what that mental wellness might be about, it's really important to connect with a lot of different resources if possible to find which one really resonates with you. A good starting point is something like BISP, the Brain Injury Society of Toronto, or there's typically an organization much like BIST I know there is in Hamilton and Peel Region and Durham Region, and they will have a lot of different resources there that you could access to learn more about how to help yourself, which is really a key piece to getting back to a state of wellness. Otherwise, connecting to your hospitals and speaking to them, and just whatever local community resources are out there, it just takes a matter of, being persistent and enlisting the support of whatever individuals like the organizations can offer you.
Mm-hmm. And I know the ABI network has recently sort of redone their website, so they have quite an extensive list of different resources for individuals that are struggling. And just on that note as well, the workshops that we're running through the Canadian Concussion Centre continue quarterly, so our next one is in September, so I did bring some flyers that if anyone's interested. And I also just wanted to mention as well, in terms of mental health support, there's a study running through UHN that provides cognitive behavioral therapy for anyone that might be interested, so I can also provide information on that later. The next question kind of follows from that, and anyone can speak to this, but just in terms of what are the gaps in treatment that you see in treatment? In terms of your experience.
My accident was 2008, and that was before Sidney Crosby was out for a year with a concussion. His injury changed a lot of things. It changed the way people thought of the injury. And am I right, doctor, that acquired brain injury is that a reasonable thing to call a concussion, or is it a mild concussion or ABI? Traumatic or TBI. Yeah, and the thing about concussions is that nobody called them brain injuries, and that's what they are. And it somehow sounds much more serious. Oh, I bumped my head, I have a concussion. No, I have a brain injury. It's different. So one of the things I'm not very good at is that my short-term memory when I'm a little under the gun is gone. So what was the question again you asked?
Just in terms of your experience, did you, I know we often hear that people struggle in terms of trying to find resources.
Oh yeah, right, yeah.
Just any gaps that you...
There was a huge gap from the get-go. I didn't really have any treatment. I was discharged from the hospital without a head injury routine. Nothing, there was a huge gap, and I went to my GP, and he's a good GP and everything, but there was really no treatment. And finally, after about 3 years of still having significant symptoms, I spoke to a psychiatrist friend of mine, brother of a friend of mine, and he said, "Boy, you got a problem." And he brought me over. He hand wrote a referral to a neuropsychiatrist at Toronto Western Hospital, whose practice was really actually closed, but it took me 6 months to see him. And that's where my treatment really changed, was with Dr. Sayone at Toronto Western. And, but that was 3 years later. And he said, 3 years, that's a long time, he said, for symptoms like this. We got to figure out what's going on. And it turns out that I wasn't sleeping very well. And sleeping is when the brain rewires, and the brain can rewire. Neuroplasticity is the term that's used. The Brain That Heals Itself is a spectacular book if you haven't seen it. As far as my mental health went at the time, it was really just anxiety for me. I battled depression early on in my life, but I was well managed, and there was no gaps in that part of it. The gaps were really in how to treat my symptoms of concussion, which would allow me to do things in a kind of a normal way, or do things at a high level again in the Toronto Symphony.
Yeah, I'll also add to that. I think in my experience, the gaps were, concussions are really interesting in the sense that, in my mind at least, it's a physical injury and a mental injury combined. And that's so an injury to your mental health as well. And I found for me that there was a huge focus put. I'm really lucky that I found specialists who understood what I was going through with by the second or third month, which I'm very grateful for. But a huge emphasis was put on my physical health, which I'm very grateful for. But the only kind of mention I got about mental health and concussions was them saying, like doctors saying, you might be a bit sad because you're not in school, you might be a bit annoyed or sad that your life is a bit different. And I never heard words like depression or certainly not anxiety or PTSD and those terms. And it wasn't until maybe the 5th or 6th month after my injury, which isn't that long comparatively to a lot of stories, so I'm grateful that I came in contact with a therapist at Social Work Consulting Group in Toronto, which actually is a social work and counseling group that focuses specifically with neuro injury, which is great. And it wasn't until then that I realized that mental health was even something that was talked about or that happened after concussion. So I think for me the biggest gaps is the consistency of knowledge that is maybe known by people about concussions, mild traumatic brain injuries, and mental health, and then the connection between that and then giving support. And brain injuries are invisible, and so you have to be your own advocate, but if you're not given the knowledge that something might be wrong with you, how can you advocate for yourself, I guess? So that's my biggest gap there is, I guess, knowledge.
Mm-hmm. That's great, and that flows really nicely into the discussion, which is about concussions and often traumatic brain injuries being kind of an invisible injury. And then, that can cause a number of problems, but one as well is not even just for the person that has a concussion, but for those family, for employers, for, friends, people that you know. I don't know if anyone wants to comment on that.
It's been one of the focus points for a lot of the brain injury groups is to raise awareness around that issue. And there is a lot of attention given to the physical piece of an injury and not as much, because it is very unknown. It is invisible. It's just, a lot of people come out of an accident or some sort of traumatic injury and they're very focused on healing physically, and they are not even hearing some of the recommendations when they are given because they're, still focused on getting back to who they were. And then that realization may come in for some, and it's like, oh, so there's a whole different path I have to travel now for a while. And it's accepting that and connecting and figuring it out and understanding that, and as well the individuals around you, and how do they understand you now, and how do they work with you, and how do they live with you, because you are in some cases a very different person, and you see things differently, you tolerate things less well. So the Brain Injury Society right now, we've spent a lot of our resource of time trying to educate, bring awareness, develop some understanding of what these individuals are living with and what that might look like. So, I've been to a couple of the homeless shelters. There's a lot of brain injury that may be occurring there that is not being, the individuals that aren't necessarily going for medical care. They're not understanding what has happened. Sports injuries gained a ton of attention, and that's great, but there are many other areas that need that.
And I just want to add to that, because even in clinic, when we see people who have suffered the injury and feel that things are different, really when you broach the subject that, mental health is impacting their headache and their sleep and their ability to function, it's like, well, but I'm not depressed or I'm not anxious. And they don't want those labels, because our society as a whole, it's not just about concussion. It's about all brain diseases, whether you have multiple sclerosis or tumors or Alzheimer's disease. People don't really want the label that there's a mental health issue. And, when your brain changes, you change. And depression and anxiety and PTSD, those are the same networks that, subserve your memory and subserve your ability to concentrate and to think. So it doesn't really make sense to think that you're going to have an injury to the brain, a specific network is going to break down, and there's going to be no impact on your mental health. That actually isn't realistic. That isn't the way the brains work. And there's a lot of research that's been done, and we know that. But it's been really tough to bring that to the pop culture level and say, yes, when something happens to your brain, you will change. And I think that it's really important that even people who have the injuries really understand how much of an impact their mental health is going to have on all those other symptoms that they're suffering from.
Just a quick story about what changed for me, and I don't know why this happened. I'm really glad it did, but when I spoke to people generally, expletives were a significant part of my colorful language, many of them, and that's just wasn't. I don't look back at it with. I'm not very happy about it, but funny after I hit my head. That stopped, just like that. And I went, wow, what's happened? This is really good. So, but things changed. That was a dramatic change for me, and a very positive change, actually. But that's what can happen.
I think I maybe have one other thing to say about the invisibility of it and how that links to maybe people around you or support networks, caregivers. One thing I found with my mental health specifically is, and David kind of spoke to this, is I kind of rebranded my concussion as a mild traumatic brain injury, which it is, but I kind of ended up saying that to people instead of concussion, because when I said concussion, people thought they knew. They said, oh yeah, I got one once, felt fine 3 days later, I had a headache. So they kind of had an understanding of what it was, or, oh yeah, like a hockey player got one and he was fine the next game. So there was a lot of understanding linked to concussion. So I kind of rebranded it, but then I found that even with that rebrand, even if that made people understand the gravity of the physical situation, they really weren't understanding the mental aspect of it. And I actually had, with no ill intention, I had some people in my life who felt almost frustrated with me for misusing, they felt mental health language. So when I was saying I was depressed, it kind of bristled them. They thought, well, no, I have depression. You don't have depression, you have a physical injury. And so I think the invisibility of mental health and then the invisibility of brain injury, it's a double difficulty there. And I think with the hard thing with I forget what I was saying. I also have weird memory now. But yeah, just the fact that I think, this is it. I think a huge part of people seeking help for themselves and being their own advocates has to do with a validation of what they're going through. And I think that if people are kind of like, oh, you're sad, or oh, you just have a physical injury, you're not likely to take yourself seriously. And that's what happened for me until, again, about 6 months after, when a therapist was like, no, listen, there's stuff wrong. And that was huge for me and very empowering. So I think, again, just if more people know about, lost my train of thought. I think if more people know about the mental health aspect, it creates more empowered individuals as well. Yeah.
That's great. Thanks, Sophia. The next question is directed mostly at Dr. Tartaglia. Can you just speak about the research that's being done in terms of concussion and mental health?
So, as you probably all know, there has been kind of an explosion of knowledge in this area, even though there's great gaps that still exist. Partially, this has come about with some of the former football players and the tragedies that have, happened with them. And so, this idea that multiple concussions can lead to neurodegenerative disease and chronic traumatic encephalopathy. And as kind of a consequence of this, people have started to pay a little bit more attention to concussions, to the single concussions and to multiple concussions. And so that has opened up a lot of research interest into this area, because obviously if multiple concussions have been associated with chronic traumatic encephalopathy, as well as with other neurodegenerative diseases, including Alzheimer's disease, Parkinson's disease. And so people now are starting to pay attention to, okay, well, when you have that concussion at this moment in time, is something actually happening? And what is happening to the brain? And is it setting you up for something in the future? Or, is it like you have a concussion, your brain heals, and there's no relationship? The exact relationship between concussions and later neurodegeneration is actually not clear. We have many people who've had many concussions in their lives, and they are 80-something years old and perfectly fine. And there are people who have had one concussion and they're 20 years old, and they are 30-something years old now, and they're not fine. There is probably a genetic component, and we're looking very hard at that. There's probably resiliency components versus vulnerability components. And so, it's an area where, for every step that we take forward, okay, we're realizing how little we actually know. We don't have very good animal models of brain injury, especially concussion. We don't know the role of inflammation. We don't know, these buildup of proteins that happen in neurodegeneration. Do they happen at that one concussion stage? Well, 90% of people recover. So what's happening to the people who don't? So there are a lot of questions, but at least now there's been a lot of attention directed to this problem. So we're not, even though we call it a mild traumatic brain injury or a concussion, we know that it is a brain injury, and that we need to understand what's happening to the brain, because all the symptoms that you have associated with that brain injury mean that something has changed, whether it's the mental health, whether it's the cognitive, whether it's the motor. Something has changed in the brain, and that change, we can't pick it up. So in our research program, we do sophisticated imaging. We're looking at the blood. We're looking, in some cases, at cerebrospinal fluid. We're looking at eye movements. We're trying to figure out what is the way to pick up that somebody's brain is different, and that's causing many of the symptoms that they have. Because we do believe that that's going to be the first step is, a lot of people, 10 people will complain about the same symptoms, but that doesn't mean all 10 of them have the same change in the brain. And so that's really lacking now, right? When you're worried about diabetes, somebody does a blood test and tells you have diabetes. If you're worried about thyroid, it's the same thing. But when you're worried about concussion and the post-concussion syndrome, and is there a change in your brain, we actually don't have any measure of that. And so think of if you want to give a treatment to somebody. Well, it's hard to track anything, right? Because it's hard to treat symptoms sometimes. And sometimes they take a long time, so you'd like to have some marker to be able to follow. We have nothing like that. But there is actually a lot of research being directed at trying to discover markers of post-concussion syndrome, as well as the brain changes with more and more sophisticated imaging being done. And we are optimistic, but we're not there yet.
Great, thank you. The next question, it probably follows, and I don't know whether you can add anything further, but how can the findings of the studies and advances in the research be used to help improve support for concussion patients?
Well, I think the first step is if you can actually start to, we lump everybody together, right? And we say, okay, well, you have post-concussion syndrome and you fall into this big group. But if we could actually figure out ways to separate the groups, like some people have only motor problems, some people only have mental health problems, some people only have visual problems or vertigo or, concentration problems. So I think it would be better to be able to create more homogeneous groups and then try to target the treatments. We're going to try to start a melatonin trial because we do think that sleep is a huge problem and impacts many aspects of your your cognition and your mental health, and yet it's completely ignored. You know, but not everybody has a problem with sleep after they have a concussion. Some people sleep very well. They don't think about it at all. So, you know, I think that the problem we have is we try to put everybody in the same box, and without more research and more targeted treatments, it's going to be really tough to solve this problem.
Thank you. This next one, anyone can jump in. How can we better support the mental health of concussion patients? Any ideas?
Somebody else go first.
Well, I thought of something while you were speaking. I haven't taken science in like 8 years, so I don't understand all the studies, but I do see increasing studies that are coming out about specifically concussions and mental health as well. There was the one, I think, out of Sunnybrook last year on concussion and suicide risk, and there's increasing studies. I think the trickle-down effect of those studies then being present in conversations between doctors and patients is, I think I already said this, but to drive the point home, I think that's a huge place where we can improve support, is if, and even prevent mental health from becoming a neglected part of the concussion recovery. If in a doctor's office or in a hospital room or at a neurologist, a patient is being told, you know, pay attention to your physical health, also pay attention to your physical health, report to us just as much as you would with your physical health if something's wrong with your mental health as well. Especially if we're looking at things like long-term kind of major depressive episodes or suicide risk and things like that. Prevention of something getting worse or going wrong can be, I think, helped by conversations earlier and just like the awareness level increasing.
So when we're working with, if I'm working with an individual in the community, I really look closely at what they were doing and what they were involved with before their injury. And their values. You look at, okay, where are you gathering your sense of life purpose, your sense of where you're gaining your self-esteem, what's important to you, and what pieces of that are you no longer participating in, and then figuring and supporting them to understand that side of it, because sometimes things drastically change. You're no longer able to participate physically in activities, which is a huge piece of mental health for some people and may affect others more so than others. So then looking at ways to build that back up in their life so that they can work through that. And again, the physical side of the injury within the brain is really hard to identify. There are different things that work for different people, but just looking at those life changes and what's happened for that person, coming from that side, connecting them. So a lot of what the societies will do, the brain injury societies will do, is about building a community for individuals who have suffered an injury so that they can speak with peers that have gone through the same experiences. They can have services for their caregivers and their family members, so as I was mentioning, they can understand what's happening, and they can look at ways to, if I'm working one-to-one, I'll look at ways that they can give back and gain those same senses of purpose, that same sense of purpose they once had in their former occupation or their activities. You know, did they go to church? Did they participate in like a UCW, like helping out within that church? Were they involved at the local library? Did they volunteer in a classroom? And how are they going to regain those feelings of contribution and connection?
And by the time they come to me, I mean, most people, I don't see people who've had acute concussions. They've had persistent symptoms, and usually for at least 3 months. And we really try to get them back to, you know, their previous level of functioning. And so we treat all the symptoms we can treat. The brain recovery, we don't have any treatment for that. The brains heal themselves. In some cases very slowly, in some cases incompletely, but they heal themselves. We don't have any magic treatment for that. We do have treatments for other things. We do have treatments for headaches, and we have many, many treatments for headaches. We do have treatments for sleep problems. We have good treatments for mood issues, for anxiety. We have great knowledge that physical activity, okay, doesn't matter what it is, but really trying to get as much physical activity as possible is really good for the brain. There's lots of evidence now that it can delay neurodegeneration. There's growing evidence that it's good in brain injury. There used to be this idea that you had to rest. That probably came about because a lot of concussions were reported when they were happening in sports. And so if you're doing a sport and you get a concussion, the worst possible thing would be for you to continue that sport and get another concussion while your brain is still healing. So because of that, there was this idea that you really had to rest. And so sometimes I see people, they're a year out and they're still resting. And I'm like, this is really bad for you. This is bad for your brain. This is bad for your heart. This is bad for all your muscles. No more resting. And so we try to get people back to their regular life because, active people, that defines you. So you are upset. People who go to work, well, a lot of times our work does partially define us. Being in, activities at school so we try to move people closer and closer to their life before and try all the treatment avenues. And I have to say, we directly address mental health in my clinic, and it is really, really frequent that people are very reluctant to treat their mental health. They don't want to be treatment. They don't want any treatment. There's some strange perceptions that they're going to be addicted to antidepressants, which I've never even heard of, and they're willing to try all kinds of strange treatments that don't have any basis in fact or science, but they're afraid to try an antidepressant because they're afraid they're going to end up on this forever. And it's like, no, we put people on antidepressants all the time and take them off 6 months later or a year later when they're back to the regular life. Even sometimes, I saw a patient not that long ago, she had a concussion over 10 years ago and no longer working, no longer doing anything. And within 9 months, she's got a better job than she had before. She's off the antidepressant that I put her on. And her husband's like, you gave me back my wife. Like, she was a completely changed person for 10 years. It's, that shouldn't happen anymore.
No,
Do you want to add anything?
no, this is fascinating. I'm good, thank you.
Well, the next one sort of follows in terms of, I think there's still a lot of discrepant recommendations that people are getting. We certainly hear that when we're running the workshops, in terms of how much rest to get and staying in a dark room, that kind of thing. So the next question is, how can we change and improve the way patients, doctors, caregivers, employers, and others respond to and support the mental health impacts of concussion?
I can talk to that one. I don't know how many of you folks here have experienced, or you have loved ones who have experienced it, or how many are just sort of interested in this subject. I think the biggest thing that, if I could come up with, the biggest thing that didn't work for me is that, and Sophia alleged to it, you look normal, you sound normal, you are anything but normal. And when somebody's like, I would misplace my keys, and I can see you're all going, oh, that happens to me all the time. Not like this, it doesn't. Let me assure you. I know exactly where they are. They're behind this little door here, and I can't open that door. If I opened that door, I'd walk straight to them, right? Or if in my case, I couldn't remember a name of I was in a dentist's office and a Beethoven symphony was playing. Well, I've been listening to Beethoven symphonies for 45 years. I couldn't name it. Until then they back announced it. I go, oh, that's Beethoven. We're not normal, and we're recovering. So I think that understanding that we're recovering and that we are anything but normal would be a huge gift to somebody who has been injured in this way.
Yeah, I think, again, I feel like I've said this already, but I just really feel it passionately. But I feel like, again, that just acknowledging, if you know someone who has a concussion, just kind of being aware of, or if you yourself get one, just being aware of the fact that your mental health may be impacted, or that their mental health may be impacted, or their physical health, and just kind of being aware of it, because again, that validation or that acknowledgement can be really empowering. Yeah, and I think that, there's a lot of stories. We do education workshops in schools about concussions with the group in Montreal, and one of the examples we always tell is about athletes, professional athletes who have kind of told their teammates, or school teams that have told their teammates, like, I don't think you're okay, and maybe you should get checked out, maybe you should take a sec, and just being advocates for each other and being an ally. But then again, the biggest thing I think is being an advocate for yourself. You know if you're not okay. And like David said, it's so frustrating when people say, oh yeah, like, I've had a migraine before, and you're like, no, I mean, I've had a headache for 10 months. Like, this isn't the same thing. Or, yeah, and just kind of, I don't remember what I was saying, but completely different start of a sentence. The other thing that I just wanted to bring up is validating the grief aspect of after a concussion. People have lost a lot. People have lost, as Dr. Tartaglia said, you know, your brain actually changed, you've changed, and just kind of validating that they're going through something. Yeah.
And I can just say that I think, you know, education is really, really essential. I mean, we're really fortunate because Dr. Ruttan has set up this great education workshop, and it's happened so frequently that patients will come back to me and say, you know, really, just being in a room, hearing all those things that can happen, being with other people who suffered through this. I think, you know, isolation, once you've had a concussion, really feeling it, you're alone in this is really going to be a setback. So, you know, reaching out, talking about your experience, I think is a great thing, because this is so common. There are millions and millions of concussions. I mean, we're lucky that most times, you know, you get concussed, you'll get better, but it's millions. And so there's bound to be somebody around you who is struggling and doesn't even realize that, you know, this happened after kind of a, you know, sometimes it looks like a trivial injury, but it's not trivial. And everybody can talk about when they fall off the curb, you know, like they twist their ankle, and it's excruciating, and some people can have really devastating problems, but it's almost like not the same when it's, oh, I just hit my head, you know, on the door, and now I'm, you know, 3 months out and I can't get back to work. It's like, well, yeah, it happens. We don't know why.
Right, and I think we're still learning so much.
Yeah.
As you said, we know so much about the brain and yet so little. So to translate what your regular GP or medical doctor should be looking for or talking to someone about is also, I think, slower in coming. I don't know about that communication from your sort of studies and research to the general GP, what they're gaining, and so I think it's through discussion, and it's through, you know, when you go to the doctor talking about it, if they have enough of those, if they hear enough of those conversations, they'll naturally generate some more knowledge for, and you know, them to step back and go, okay. And for our part, through these the Brain Injury Society, it's we're really trying to reach out to medical clinics and let them know we're there. We've connected more with the hospitals, the whole UHN, connecting, and you know, we're here. It's a free service. Basically, everything is free. You know, there's small fees where we have to put them in, and we try to get sponsorship, but we're trying to make sure that there is a place, and in more rural areas it's definitely less.
Yeah. It's a big problem.
It is a big problem, and trying to figure out that piece for sure. But in the more urban centers, there will be groups out there, and you know, seek them out and talk to people and make sure other people know about it too.
And there will be concussion guidelines coming out, again reiterating a huge part of the new guidelines focuses on mental health, and really trying to get people into mental health services or get their mental health issues addressed earlier rather than later, and not even waiting to be able to see a psychiatrist or a psychologist, because it's really tough and the waiting times are quite long. And we do think that earlier interventions are better, so that people just get back to their regular lives and, you know, move on.
Sorry. Yeah. I was going to say just a brief kind of anecdote. So we do a support community kind of meetings and events in Montreal for people who are recovering from concussion. And just to speak to how important it is just to talk about it, we had one girl from the field hockey team at McGill come to one of our hangouts. You know, we just hang out, we do homework, we talk, we sometimes do yoga or meditation together, we go hiking, because physical activity, huge, paced of course, but huge. And we had one girl from the field hockey team come. And within the next few months, I mean, this is unfortunate that it happens so frequently, but we had 2 more people come from the same field hockey team. And it's because they knew about not only the resource that was there, but they knew that it was an option to seek support for your concussion, mental, physical suggestions, just to be validated, because you're in a room with people who know what's up, because you can't remember what you were saying a minute ago, or you've had a headache all day. And just that ripple effect of really, the one girl talked about it, and so her whole team now knows that to take their own injury seriously. So yeah.
That's great. And I think it's great that BIS too is reaching out to different organizations. Through the ABI network, I was sitting on a concussion committee, and I know that was one of the gaps identified just in terms of like educating physicians, because there's such variability. So on that site, they've actually put together, they've sort of extracted main points from the guidelines. So it's something, so.
There's even been a connection made to the police at this point as well, which is great. What am I looking for if I'm dealing with someone who I may have run into some conflict with the judicial system, and what does that look like? What does a brain injury look like? And how do I approach that individual so that things run more smoothly? I mean, there's another scary fact. I think it's upwards of 60% of the people in our correction system are potentially have brain injuries that are unidentified. So not only are they there because of some misunderstanding, some behavior that's resulted from the brain injury, they're not gaining services there, and they're not being understood there. So sometimes they are going from a minor crime or a minor incident further into the system because of what's happening within that. So it's just education, I think, and helping people to help themselves, and helping those who are working with these individuals to help them.
That's great. Thank you very much. I'm just conscious of the time. I think the plan was to open it up. Katie, do you want to?
We wanted to do some Q&A now. We have some microphones here, so if you want to just hold on until we get a mic in front of you, then it's better for audio. Was there a question up at the front?
Would you put motivation and initiative under mental health?
Yes. Judgment,
Judgment,
motivation.
yeah.
Lots of our
Yeah.
patients are very apathetic. They were the most interested in all their hobbies, and they give them all up.
No, the reason I say that is because I've actually worked with people with ABI, and I've had professionals just say, "Oh, they're not interested. They don't want to do that. They're lazy," and these are professionals. So who are supposed to be social service workers, support persons, or so forth. Oh, they're not hungry, they don't want to eat. But actually, the reason they don't want to eat, they've lost the initiative to eat and to say, oh, it's time to eat. And after a while, of course, their system gets used to eating nothing. So then it hurts when they eat. So I think it's not just, I think everybody needs to really be educated. That even some simple things as motivation and initiative. It's not that the client does not want to do something. They actually need assistance in moving them forward to take these actions, and actually having reminders. Why do you want to do this? This is your goal. This is the goals. These are things you're interested in. This is why we need to do this. We need to take these steps, because they forget you need to do these steps to get to that activity that they actually want in the long term. And so I think those 2 words should be included in the mental health talk a lot, including even issues on eating and so forth. Yeah.
I was sort of interested in if there's any research or anything about the differences between men and women, and how they how they respond to concussions in terms of like the development of mental health issues and how they respond to them. Just if there's any research or any work kind of in that area.
Yeah, there's actually a lot of research being done in that area, because there seems to be gender differences. So right now, the thinking, but these are at kind of an observational level. So we don't, we can't really take them at face value. We've seen in the past how, these kind of studies lead us astray. But right now, the thinking is that women seems to be more vulnerable than men at persistent symptoms. and at suffering concussion. So it looks like the same injury in a man and the same injury in a woman is more likely to result in concussive symptoms in the woman than the man. And yes. And secondly, it looks like the duration of the symptoms is longer, so the chance of developing a post-concussion syndrome seems to be higher in a woman than a man. We don't actually understand why that is. We don't understand if it's a physical thing, like, you know, some people say, well, the neck muscles are different, so they're not able to take as much impact. There's a hormonal differences. We don't understand what the cause of the difference is, but there is evidence that it looks like women seem to be a little bit more vulnerable than men to concussion and post-concussion syndrome.
Yeah, I would also just say, I think that, I mean, it's just a humble observation, but I think also that there's a difference or a gendered stigma in seeking mental health services. So maybe the likelihood to seek services or to go towards that mental health label is different for different people, and that's for so many different identity factors, but I think that's part of it as well, possibly.
Just going off of that question, is there research on how successive concussions can either worsen symptoms or bring on new symptoms? Or because I know, I guess on the physical side, it's they say that if you've had one concussion, you're more susceptible to get reconcussed. But in terms of like how the symptoms play out afterwards.
Yeah, so multiple concussions is the single most important risk factor for developing a post-concussion syndrome. And a post-concussion syndrome, by definition, includes cognitive issues. So it's not just headache or dizziness, or it includes cognitive. And along those cognitive issues, usually is a mental health issues. So yes, multiple concussions are really, really a significant risk factor for persistent symptoms and worsening of symptoms. I mean, it's not unusual for us to have patients say, you know, they had a concussion, they were recovering, they were like a year and a half out, they got another concussion, and from a very, very minor injury, like your child jumping on your lap, not doing anything, you know, but just kind of your head moving quickly. So it seems like even your threshold for suffering a concussion seems to be lowered when you have multiple concussions. And that's why, you know, sometimes we have to tell people to stop doing the activity that they're doing. So a lot of times I've faced this when people are, you know, pro or semi-pro athletes, and they've suffered multiple concussions, and they're, you know, they're a year out and they're still having symptoms. It's like, you really need to think about the, you know, the marathon of life, right? It's nice that you're okay for the sprint, but you need your brain, and your brain, the lifespan now is 85 years, 86 for women. So it's okay that you're going to feel okay when you're 35, maybe you're 34 today, and in a year you will recover. But is your brain going to be okay when you're 70 years old? And that's the kind of stuff we're thinking about. And so sometimes we tell people, it's, you know, stop playing. Find another activity. We promote aerobic activity, but not a contact sport.
So if, as Dr. Tartaglia was speaking, it struck me that if you if you hit your thumb with a hammer, it bruises, it hurts. If you hit it again a week later, it's going to really hurt, versus if you hit it again in a couple of months when it's healed up. And the brain is, I think, is the same. I had a secondary injury, which was relatively minor. It was about a year out, and that was the injury that ended my career.
Any other questions? Yep.
It occurred to me when people were talking about stigma and that it's invisible, and once the physical part's healed, there's no indication to friends and loved ones that there's still stuff going on. Would it be helpful to have something like this is just an idea I'm throwing out, a bracelet similar to people who have allergies or asthma or something like that, that you wear when you have a brain injury, so that people know there's something going on with you and check it like if you get in trouble with the law, or you fall down, or you end up in the hospital or something, that they're aware, oh, there's the added factor of a brain injury here.
Yeah, that's a really interesting point. A small anecdote, I was doing balance and vestibular therapy after my concussion, and at one point my physiotherapist would have me have a weighted vest for some exercises, because it helped kind of, you know, let my body know I was standing still, so it would kind of help with my vertigo and that sort of thing. And I remember thinking to myself that I really hoped that he made me wear it on a day-to-day basis, even though it looked like I was like a SWAT agent or something, just because I really wanted to have some sort of like huge glaring, like I'm not okay symbol. So it is an interesting idea. I think that on the one hand, it's such a pity and a problem that people can talk about twisting their ankle or about having diabetes or something, but you can't really talk about having depression or something like that. Simultaneously, I will also add that I definitely came to a point where I don't want people to know about it too. I'm kind of like, it doesn't define me, I'm fine. And then the next day I'm kind of like, why don't you know I'm not okay? Like, so I think it's a really interesting idea. And again, yeah, I definitely wish I had some sign on my forehead a lot of the time for the first year, especially, because communicating it can get very tiring.
We have time for about one more quick question. Otherwise, we will wrap up. Yep. It's got to be quick, though, because you don't have much time. Oh, good. You've got a microphone over there.
Hi, I'm really great. There's people talking about this and presenting the public with information. I had a concussion from a car accident a couple of years ago, and in short, I can just say that I could say that in a sense I've had what can be termed a kind of a hard life. I've had all kinds of things happen and blah, 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 but due to upbringing, due to various things, I was able to deal with that. But when I had the car accident, all of those situations that have happened that have been challenging and difficult came forward, and I found it very difficult I was denied by insurance services. I attempted to get it through my doctor. We had reduced income. We had all kinds of challenges. And it became very difficult. I had all of these symptoms that you talk about. I didn't know what they were at the time. So I've had a period of several years just seeking, and finally, after 2 years now, I'm able to see somebody and get something going. So what does, like, it can happen to any person at any time. And there doesn't seem to be a place where somebody can just go, oh, I have this, I can go here and get information, and so what does somebody who is just totally has no clue about this, and I have just a tiny clue about it before and a bit more now, but where does somebody go when this happens? Probably you know, but I don't know if it's out in the public knowledge or whatever. So that's my question.
So I think we're hoping to get it to that level of public knowledge. I mean, that is one of the goals of the BIS Society, to be that center. There is the ABI network. There are hospitals. It's about what you've been doing. Keep looking. And we are building, and we are connecting more amongst ourselves to be able to raise the information, like raise that knowledge, raise the awareness, have the information out there on a, this is it. BIST is this society. This is where you will come to ask some of those questions. That's all I can say. We are working on it. Everyone is working on it. Everyone has the same goal, because we don't want you to be out there.
It took me 7 months. No, it took me 7 or 8 months to find BIST.
Yeah.
It wasn't findable from where I was.
Yeah. And it's because, we are volunteers, no. So, but that's what it took, and we're building, and grants are coming, and information is coming, and then we're connecting to the hospitals as much as possible so that they know we're there. So we're getting, I think this attempt to get through to the clinics and the medical doctors, and, So I guess, yeah.
Maybe my real question is, what would it take to get it bigger? Maybe other.
Well, maybe I'll speak to
Yeah.
that one, because there's actually going to be hopefully legislation in the next little while. There's a young girl who died a few years ago, Rowan Stringer. She was a rugby player. She ended up with 3 concussions over 5 days and actually died after the last one. And her parents have taken this great tragedy and are trying to get legislation passed in Ontario where people have to be really attentive to concussions. And with that, there's going to be greater knowledge. So we're hoping that bill will come through in the fall, and that with that, there'll be a huge campaign to really make people aware, because right now, it's very heterogeneous. There's some agencies, there's some places here that are fantastic. Whether you're at the workplace or in a hospital or you go to a clinic or you're in the school, you get great accommodations. People know exactly what they have to do. But the problem is that it's very heterogeneous. And so depending on where you end up, you could never even find out about BIST. And that shouldn't happen. So we're trying to create a more standardized approach to any concussion that is suffered by anybody, whether it's a child, whether it's an adult, whether it's an elderly person. And it doesn't matter where you will go, there should be a standard of care. So that's all we can say right now.
Are doctors getting more training? Many doctors don't have.
No, I know. So in neurology, so I started a concussion fellowship, and so we are training neurologists. And so there's more and more, but actually when I trained, there was no teaching about concussion. And so I often hear people, who are family doctors who really tell me, it's like, well, I didn't really realize it was a brain injury. And I'm like, okay, the problem is actually the lack of respect for the brain. Okay, we're a very heart-centric society. I mean, people still think love is a heart thing. It's like, your brain loves, your brain hates, your heart does nothing except keep the brain alive. Not to be, but that's it. And so that's the problem. The problem is understanding that when your brain changes, you change. And that part is lacking in our society and education, in medical schools, everywhere.
Emergency physicians really don't.
Yeah.
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 It really
And that's often
depends.
the first place people go.
Yeah.
Yeah.
It
And
really
then they get sent home, well, you had your bell rung, if you're okay in a couple of days, you can go back.
Yeah.
I was sent home without a head injury routine.
Yeah, same with our son.
Yeah.
Yeah,
Go
and it
figure.
really depends on what hospital that you end up
Exactly,
with.
you know.
So at Toronto Rehab, we actually have a concussion research clinic, the Hall Ellis Clinic.
But that's not a place you can go for emergency.
No.
But
We
they're
were not
taking people
referred.
direct.
This was sick kids.
Yeah, they're taking people just from the Toronto General and the Toronto Western and Mount Sinai and Merge. So again, it's a research clinic, but if you happen to end up there with a concussion, you will then be referred on if you wish to participate and actually receive ongoing care.
We would have loved to,
So,
we couldn't
but,
get in.
yeah, no, I know, it's inconsistent. It really
Yeah,
is
and that's the thing, because you have to go there within a certain amount of days. There's no standard approach, and this is a huge problem. In the remote communities, it's terrible. They have no access to anything, really, and it's really unfortunate. So I think it's really important that we, first of all, realize that this is a brain injury, and we need to think about, what a brain injury really means. And secondly, that we have a more homogeneous or standardized approach. And so that if you go to your family doctor, if you go to the Emerge, if you go to a walk-in clinic, you're going to get the same kind of treatment. And,
But they know then who to refer to.
right, and depending on which stage you are, because most people get better. Most people don't even go to a doctor when they get a concussion because they'll recover. But the people who aren't recovering, the people who, are really feeling something, they need to have their symptoms treated. And actually the guidelines really speak to that, is no more waiting around, all the symptoms have to be addressed, including all the mental health symptoms and the cognitive symptoms, not just the headache and, the dizziness and stuff like that.
Okay, we're going to wrap it up there. Thank you so much, David, Colleen, Dr. Tartaglia, Sophia, and Dr. Ruttan. I'm gonna blank. I was on a roll there. Thank you so much for coming, and thank you all for coming. We have another Lunch and Learn scheduled for August 23rd at the Lillian Smith Library. It's on the Chinese community and mental health, so it's a uniquely ethnic Toronto event. All are welcome. It should be very interesting. There's a lot of cultural disparities on how people seek help in that community. So, and then September, keep watching for our film festival, movies and mental health lunch and learn. And in October, we're going to be doing something a little bit different, a bit of a hike and learn. So wait for details on that. We're going to get people outdoors and some mindfulness and that kind of thing. So thank you again, everyone, for coming. You are now dismissed.